Tell me about your symptoms before the surgery.
I could hardly walk with sciatic going all the way down my leg.
1 to 10, how bad was the pain?
At times it would get to be a 9 or a 10
How long did you have the pain?
for about a year, but I'd get shots
Yeah,
and
yeah,
they helped tremendously until
Yeah.
they wore off.
Yeah.
And then it would go right back up.
yeah. And what did you notice about how his life was before the surgery?
It was, his quality of life was pretty low at times. I mean, he would have to go
Mhm.
sit down or wouldn't be able to partake in normal activities.
Mm-hmm.
He would favor it. He wasn't himself for quite a
Yeah,
while.
yeah. That I hear a lot that the whole family suffers. It's not just the one person suffering, and because people cannot participate, they are irritated. The pain just doesn't help any kind of the relationship or activity or life. Now you did conservative management, right? You just talked about the injection and so on, and
Yeah.
you
And I
did physical therapy.
Chiropractic.
All of that didn't help you.
No, it actually
Okay.
might have made it worse.
Well, and we did that surgery about a month ago.
Yeah.
Now, I'm going to turn around and show what we did. We did the L5S1 OLLIF procedure, and as you see, the cage is exactly in the middle, and we had to, in your case, I'm going to come to the model here. The bone on the left side was growing so bad, I wouldn't get the regular access, because whenever I was trying to get the regular access, I would hit the bone. And in a few years ago, we would have just stopped there and had to open new and do it old-fashioned surgery. But now we have developed new methods of doing that. We specialized instrument. We can punch a hole safely through the bone to get in, and that is exactly what we did. Here is the angle. Look at the angle here. This is what we did. We punched a hole right through this. You see the bone is removed there.
Yep.
Right there, the bone is removed, and we punched a hole here to get safely bypass the nerve and put that cage in. And the surgery, I have the hospital record, it took us 42 minutes, 25 cc of blood loss, and you stayed just over the night in the hospital. Is that right?
Yep.
So tell me, first of all, how did the surgery go?
Excellent.
And the pain that you had in the leg, is that still there?
Nope, that's completely gone.
Okay, and the pain is usually my patients are telling me the first thing to go, but you still have some numbness there,
Yep.
correct?
On the outside of my calf and my 3 smaller toes.
Yeah,
But it's different.
different. You already noticed different. How long before the surgery did you have that numbness in the leg?
About a year.
1 year. Usually, generally, in neurosurgery, we say same amount of the time that you had it before the surgery it takes for it to come back. But I noticed that my patient telling me it took them, they heal and they get better twice as fast usually with the numbness, but still that take longer. Usually patient telling me they woke up and the leg pain was gone. Was that the case with you?
Yep.
Okay. And overall, what do you notice now the difference between how he was before and since the surgery?
I was really impressed with how quickly he improved.
Mm-hmm.
He even stopped taking his pain meds before he was told to, just because he doesn't need them.
Yeah, that's fantastic, and that's a good common sense.
Yeah.
Use it as needed, not just because you have it, you don't have to use it. So his daily activities now, where you expect him to be?
Yeah, I mean, the day after surgery, he was walking stairs and
Okay, well, that's fantastic, and that's all with the surgery. That was 42 minutes, and we lost less than 1/10 of a Diet Coke can blood. Now, but you suffered before the surgery for a long time, didn't you?
Yep, it was like 14 months that I dealt
Yeah.
with it.
Okay, well, I'm very happy that it really worked. Any other comment, any other questions for me?
No,
Okay,
I'm
Mark?
just impressed with how everything has went,
Yeah.
and I feel great.
Yeah, fantastic. Obviously, there's still going to be some limitation, most of that common
Yep.
sense. We're still going to send you to physical therapy to teach you what to do, what not to do, and adjust that to your level and try to make you a normal person as soon as we safely can. But overall, this is a very good result for this, and this, again, in your case, we had to use a modified version of the OLLIF, because even 4 years ago, we would have had to open you up and do it old-fashioned way. No, we didn't have to, because we have a full crew here, right in around these buildings and so on, who help us to develop it every year a little, make it every year a little better.
That's
Well,
great.
well, thank you so much for the interview. I appreciate that.
Thank you.
Thank you.
Yeah.